Hello all. ನಮಸ್ಕಾರ. ಎಲ್ರೂ this is a highly interactive session. This is going to be a highly interactive session. So make sure nimna kardaga you please ask questions or discuss whatever is needed. Okay. Namaskara. Happy Sankranti and Pongal to all of you. And this is a dedicated session that we are hosting from Mirror Health to commemorate the Maternal Health Awareness Day, which is celebrated on the 23rd of January. So, ನಾವೇನಕ್ಕೆ ಇದನ್ನ ಮಾಡ್ತಾ ಇದೀವಿ ಅಂತಂದ್ರೆ ಅಮ್ಮನ ಒಂದು ಆರೋಗ್ಯದ ಬಗ್ಗೆ ಮಾತಾಡೋದಕ್ಕೆ ಈ ಸೆಷನ್ ನಾವು ಹೋಸ್ಟ್ ಮಾಡ್ತಾ ಇದೀವಿ. ಅಮ್ಮ ಅಂತಂದ್ರೆ ಬರೀ ಪ್ರೆಗ್ನೆಂಟ್ ಮದರ್ ಅಥವಾ ಮಗು ಇವಾಗ ತಾನೆ ಡೆಲಿವರಿ ಆಗಿರೋ ಅಮ್ಮ ಮಾತ್ರ ಅಲ್ಲ. ಆದ್ರೆ ಈ ಹೆಂಗಸ್ಗೆ ಪ್ರೀ ಕನ್ಸೆಪ್ಷನಲ್ ಅಂತಂದ್ರೆ ಜಸ್ಟ್ ಬಿಫೋರ್ ಪ್ರೆಗ್ನೆನ್ಸಿ ಅಂಡ್ ಆಫ್ಟರ್ ಡೆಲಿವರಿ ಕೂಡ ನಾವು ಏನೇನದ್ರ ಬಗ್ಗೆ ತಿಳ್ಕೋಬೇಕು, ಈ ಒಂದು ವಿಚಾರವನ್ನು ಡಿಸ್ಕಸ್ ಮಾಡೋದಕ್ಕೆ ಈ ಪರ್ಟಿಕ್ಯುಲರ್ ವೆಬಿನಾರ್ನ ನಾವು ಹೋಸ್ಟ್ ಮಾಡ್ತಾ ಇದೀವಿ. This webinar, which is, this is a telecon, basically a teleconference, which is on a Zoom platform, will be hosted on our official Mirror Health website as well. Okay. So this will go across to several patient support groups. Esto jana support groups ge idana ನಾವು share ಮಾಡ್ತೀವಿ. So ನಾವೇನ್ ಡಿಸ್ಕಸ್ ಮಾಡ್ತೀವೋ ಆ ಒಂದು ವಿಷಯಗಳನ್ನ ಅವರು ತಿಳ್ಕೊತಾರೆ. So we request you to give your best when we are actually when we start the discussions. So with that, we all know maternal health is very, very important. ಇವಾಗ ನಾವು ಹದಿಹರೆಯದಿಂದ ಸ್ಟಾರ್ಟ್ ಮಾಡ್ಕೋಬೇಕು. Adolescence is the time when we can improve the nutrition of the girl, make sure she's healthy, and get into the reproductive age group with the best nutrition and the best lifestyle, including mental health, because mental health is also another very important thing that we will have to discuss now, because ivaga stress is another point which is actually leading to fertility issues and pregnancy complications. And moving ahead, pregnancy is also a very important journey that's followed by delivery, and it doesn't end there, because post-delivery also, these women have to learn to take care of themselves. There are several complications like diabetes and hypertension, which can show during pregnancy and alert the woman to take care of these problems, including hypothyroidism and hyperthyroid disorders, so that, she takes care of her health beyond pregnancy and she does not land up into complications. And I find that many of these steps are essentially missed by most women, and that's why we wanted to launch this webinar. So I think, let me just check how many people have joined already live. So we have Preeti Raj, Chetana Prashant, as well as Sridevi Nagesh Babu, correct? Okay. So namaskara ma ellargu. Preeti, can you please, thank you so much for joining. And can you please introduce yourself? I'm so glad to see you on this webinar. Lakshmi Preeti. Can you please introduce yourself and tell briefly as to why maternal health is important, and you can ask a question. Yes, Preeti, unmute yourself. Unmute. Yes, you can talk. Sridevi, next nimna karitini. Talk, Preeti. I think she is not ready. Sridevi avre, ನೀವು ರೆಡಿ ಆಗಿದ್ದೀರಾ? ಅನ್ಮ್ಯೂಟ್ ಮಾಡ್ಕೊಳ್ಳಿ. ನಮಸ್ತೆ. ನಿಮ್ ಬಗ್ಗೆ ಬ್ರೀಫ್ ಆಗಿ ಒಂದ್ ಲೈನ್ ಹೇಳ್ಬಿಟ್ಟು ನಿಮ್ ಮಗಳನ್ನ ಇಂಟ್ರೊಡ್ಯೂಸ್ ಮಾಡ್ಬಿಟ್ಟು, ಮೆಟರ್ನಲ್ ಹೆಲ್ತ್ ಅಂತಂದ್ರೆ ತಾಯಂದಿರ ಆರೋಗ್ಯ ಯಾಕೆ ಇಂಪಾರ್ಟೆಂಟ್, ಅಂಡ್ ಪ್ರೆಗ್ನೆನ್ಸಿ ಮಾತ್ರ ನೋಡ್ಕೊಂಡ್ರೆ ಸಾಕ ಅಥವಾ ಪ್ರೆಗ್ನೆನ್ಸಿ ಆದ್ಮೇಲೂ ಇಂಪಾರ್ಟೆಂಟಾ, ಪ್ರೆಗ್ನೆಂಟ್ ಆಗಕ್ಕಿಂತ ಮುಂಚೆನೂ ಇಂಪಾರ್ಟೆಂಟಾ, ಈ ವಿಷಯದ ಬಗ್ಗೆ ಬೇಗ ನಿಮ್ಮ ಅನಿಸಿಕೆಯನ್ನು ಹೇಳಿ.
ಪ್ರೆಗ್ನೆಂಟ್ ಆಗೋಕಿನ ಮುಂಚೆನೂ ತುಂಬಾ ಇಂಪಾರ್ಟೆಂಟ್, ಪ್ರೆಗ್ನೆಂಟ್ ಆದ ನಂತರ ಮಗು ಆದ್ಮೇಲೆನೂ ತುಂಬಾ ಇಂಪಾರ್ಟೆಂಟ್. ಅದನ್ನ ನಮ್ಮ ಪ್ರಕೃತಿ ಹೇಗಿರುತ್ತೋ ಏನೋ ಎತ್ತ ಅಂತ ಹೇಳ್ಬಿಟ್ಟು ನಿಮ್ಮ ಹತ್ರ ಬಂದು ನಾವು ಸಜೆಷನ್ ತಗೊಂಡಾಗೆ ಗೊತ್ತಾಗುತ್ತೆ. ಇವಳು ನನ್ನ ಮಗಳು ವಿಭಾರಮ್ಯ ಅಂತ. ವಿಭಾರಮ್ಯ ಇವಾಗ 9 ವರ್ಷ ಕಂಪ್ಲೀಟ್ ಆಗಿ 10ನೇ ವರ್ಷ. ನಮ್ಗೆ ತುಂಬಾ ಖುಷಿ ಆಗುತ್ತೆ. ಇದು ನಮ್ಗೆ ಮಗು ಆಗಿರೋದಕ್ಕೆ ತುಂಬಾ ಖುಷಿ ಆಗುತ್ತೆ. ಆಮೇಲೆ ಮಗು ಈಗ 10 ವರ್ಷ ಆದ್ಮೇಲೆನೂ ನಾವು ನಿಮ್ಮ ಹತ್ರ ಬಂದು ಸಜೆಷನ್ ಕೇಳ್ತಾ ಇದೀವಿ. ನಮ್ದು ಪೀರಿಯಡ್ಸ್ ಹೇಗೆ, ಏನಿದೆ, ಯಾವ ರೀತಿ ಇದೆ, ಹೆಲ್ತ್ ಹೆಂಗಿದೆ ಅಂತ ನಮ್ಗೆ ನೀವೆಲ್ಲ ಸಜೆಷನ್ ಕೊಟ್ಟಿದ್ದೀರಾ. ಆಮೇಲೆ ವ್ಯಾಕ್ಸಿನ್ಗೋಸ್ಕರ ಯಾವ್ದಕ್ಕೋಸ್ಕರ ವ್ಯಾಕ್ಸಿನ್ ಹಾಕ್ಸ್ಕೋಬೇಕು ಅಂತ ಬೇರೆ ನಮ್ಗೆ
ಸರ್ವೈಕಲ್
ಇಂಟ್ರೊಡ್ಯೂಸ್
ಕ್ಯಾನ್ಸರ್
ಮಾಡಿದ್ದೀರಾ.
ವ್ಯಾಕ್ಸಿನ್ ಅಲ್ಲ
ಹಾ
ಶ್ರೀದೇವಿ?
ಹಾ
ವೆರಿ
ಮೇಡಮ್.
ಇಂಪಾರ್ಟೆಂಟ್
ಹಾ
ಪಾಯಿಂಟ್ ನೀವು ಹೇಳ್ತಾ ಇರೋದು. Cervical
ಹಾ
cancer is preventable, and Sridevi is talking about a vaccine that she has been told about. ಹೇಳಿ ಶ್ರೀದೇವಿ, ನಿಮ್ಗೆ ಏನಕ್ಕೆ ಅನ್ಸುತ್ತೆ
ಅದ್ರ
ಇವಾಗ
ಬಗ್ಗೆ
ಡೆಲಿವರಿ ಆದ್ಮೇಲೂ ನಿಮ್ ಹೆಲ್ತ್ ನೋಡ್ಕೋಬೇಕು ಅಂತ?
ಹಾ ಡೆಲಿವರಿ ಆದ್ಮೇಲೂ ನಮ್ದು ಹೆಲ್ತ್ ನಾವು ನೋಡ್ಕೊಳ್ಬೇಕು ಅಂದ್ರೆ ನಾವು ಇದನ್ನೆಲ್ಲ ಸಜೆಷನ್ ತಗೋಬೇಕು. ಆಮೇಲೆ ಇದು ನಮ್ಗೆ ವ್ಯಾಕ್ಸಿನ್ ಬಗ್ಗೆ ಗೊತ್ತೇ ಇರ್ಲಿಲ್ಲ. ನಾವು ಈ ರೀತಿ ಪೀರಿಯಡ್ಸ್ ಇನ್ಕಂಪ್ಲೀಟ್ ಆದ್ಮೇಲೆ ಏನಾಗುತ್ತೆ ಅನ್ನೋದು ನಮ್ಗೆ ಗೊತ್ತಿರೋದಿಲ್ಲ. ಅದನ್ನ ನಾವ್ ಈಗ ನಿಮ್ಮ ಹತ್ರ ಬಂದ್ಬಿಟ್ಟು ನಾವು ಕೇಳಿದಾಗೆ ಈ ತರ ಇರುತ್ತೆ, ಈ ತರ ಇಲ್ಲ, ಸ್ಕ್ಯಾನಿಂಗ್ ಮಾಡ್ಸಿ ಅಂತ ನೀವೆಲ್ಲ ಹೇಳಿದಾಗೆ ನಮ್ಮ ಮನೆಯವರೆಲ್ಲ ಈ ತರ ಮಾಡಿಸ್ಬೇಕು ಅಂತ ಎಲ್ಲ ಹೇಳಿದಾಗೆ ನಮ್ಮ ಮನೆಯವ್ರು ಒಪ್ಕೊಂಡ್ಬಿಟ್ಟು ಎಲ್ಲ ಕ್ಲೀನ್ ಆಗಿ ಇದನ್ ಮಾಡಿಸ್ಬಿಟ್ಟು ವ್ಯಾಕ್ಸಿನ್ ಹಾಕ್ಬೇಕು. ಇಂಪಾರ್ಟೆಂಟ್ ತುಂಬಾ ಹೆಣ್ಮಕ್ಳಿಗೆ. ಆರೋಗ್ಯ ಹೇಗಿರ್ಬೇಕು ಮುಂದೆ ನಮ್ದು ಅನ್ನೋದ್ರ ಬಗ್ಗೆ ಎಲ್ಲ ನೀವು ತಿಳಿಸ್ಕೊಟ್ಟಿದ್ದೀರಾ. ನಮ್ಗೆ ತುಂಬಾ ಇಷ್ಟ ಆಯ್ತು. ನಮ್ಮ ಮನೆಗೆಲ್ಲರಿಗೂ ಈ ರೀತಿ ವ್ಯಾಕ್ಸಿನ್ ಬಂದಿದೆ ಅಂತ ನಮ್ಗೆ ಯಾರಿಗೂ ಗೊತ್ತಿರ್ಲಿಲ್ಲ ಈ ಸೈಡ್ ಎಲ್ಲ. ಈ ರೀತಿ ವ್ಯಾಕ್ಸಿನ್ ಬಂದಿದೆ ನಮ್ಗೆ ರೇವತಿ ಮೇಡಮ್ ಅವರು ಈ ರೀತಿ ಹೇಳಿದ್ದಾರೆ ಅಂದಾಗೆ ಅವರು ಇದ್ರ ಬಗ್ಗೆ ಇವಾಗ ಥಿಂಕ್ ಮಾಡ್ತಾ ಇದ್ದಾರೆ. ನಮ್ಮ ಮನೆಯಲ್ಲೆಲ್ಲ ಈಗ ಆಲ್ಮೋಸ್ಟ್ ನಮ್ಮ ಫ್ಯಾಮಿಲಿಯಲ್ಲಿ ನನಗೆ ಈ ರೀತಿ IVF ಆಗಿರೋದು ನನ್ಗೊಬ್ಳಿಗೆ. ಆಮೇಲೆ ಈ ರೀತಿನೂ ಇರುತ್ತಾ ಅಂತ ಕೇಳ್ಬಿಟ್ಟು ಎಲ್ಲ ಈ ರೀತಿನೂ ಇರುತ್ತಾ, ನಾವು ಹಾಕ್ಸ್ಕೋಬೇಕು, ಹಾಗಾದ್ರೆ ನಾವು ಹೆಲ್ತ್ ಚೆಕ್ಅಪ್ ಮಾಡಿಸ್ಕೋಬೇಕು. 40 ಅಬವ್ ಆಯ್ತು ಅಂದ್ರೆ ಏನೇನ್ ಬರುತ್ತೆ ನಮಗೆ ಅನ್ನೋದ್ರ ಬಗ್ಗೆ ಎಲ್ಲ ನಮ್ಗೆ ಇವಾಗ ಅರ್ಥ ಆಗ್ತಾ ಇದೆ.
ಇನ್ಫ್ಯಾಕ್ಟ್ ನೀವು ಆತರ ಜನರಲ್ ಚೆಕ್ಅಪ್ ಮಾಡಿದಾಗ್ಲೇ ನಮಗೆ ಗಾಲ್ ಸ್ಟೋನ್ಸ್ ಬಗ್ಗೆ ಗೊತ್ತಾಯ್ತು, ಕರೆಕ್ಟ್? ಅಂಡ್ ಗಾಲ್ ಸ್ಟೋನ್ಸ್ ಇಂದ ನಿಮ್ಗೆ ತೊಂದ್ರೆ ಆಗೋ ತರ ಇತ್ತು. ಬಟ್ ಅದನ್ನ ಸೊ ಅದಕ್ಕೆ ನೀವೇನ್ ಹೇಳ್ತೀರಾ, ಇಟ್ಸ್ ನಾಟ್ ಜಸ್ಟ್ ಅಬೌಟ್ ದ ಯೂಟ್ರಸ್, ಅದ್ರ ಬಿಯಾಂಡ್ ಆಲ್ಸೋ. ಅಂದ್ರೆ ನಿಮ್ದು ಬೇರೆ ತರ ಈ ತರ ಗಾಲ್ ಸ್ಟೋನ್ಸ್ ಇದ್ದಿರ್ಬೋದು, ಅಥವಾ ನಿಮ್ ಲಿಪಿಡ್ ಪ್ರೊಫೈಲ್ ಅಬ್ನಾರ್ಮಲ್ ಇರ್ಬೋದು, ಕೊಲೆಸ್ಟ್ರಾಲ್ ಇರ್ಬೋದು, BP ಇರ್ಬೋದು, ಶುಗರ್ ಇರ್ಬೋದು, ಇವನ್ನೆಲ್ಲ ನೀವು ನೋಡ್ಕೊಳ್ಳಿಲ್ಲ ಅಂತಂದ್ರೆ ಆಮೇಲೆ ನಿಮ್ಗೆ ತೊಂದರೆ ಆಗುತ್ತೆ. ಅಂಡ್ ಪ್ರಿವೆಂಟಿವ್ ಪ್ರಾಬ್ಲಮ್ಸ್, ಇವಾಗ ಸರ್ವೈಕಲ್ ಕ್ಯಾನ್ಸರ್ ನ ತಡೆಗಟ್ಟುವ ಒಂದು ಲಸಿಕೆ ಬಂದಿದೆ. ಅದನ್ನ ತಗೊಳ್ಳೋದ್ರಿಂದ ನಿಮ್ಗೆ ಎಷ್ಟೋ ಮಟ್ಟಿಗೆ ಅಂದ್ರೆ 98% ನೀವು ಪ್ರೊಟೆಕ್ಟ್ ಮಾಡ್ಬೋದು. ಇಂಡಿಯಾದಲ್ಲಿ every 8 minutes one lady is dying because she is afflicted of cervical cancer. So ಇದನ್ನೆಲ್ಲ ನಾವು ಪ್ರಿವೆಂಟ್ ಮಾಡ್ಬೋದು. Thank you so much, Sridevi. That's a very valuable advice. Lakshmi Preeti, would you want to talk? Can you unmute yourself? Yes, I can see you. Yeah, can you talk? There is some problem with the audio, so I think you should sit in a different place. Can you just try? Okay. Next I have, yeah, you may have to put in your earphones. Are you taking it on the phone?
Yeah, I'm already using.
Yeah, now we can hear you, Lakshmi. Can you please talk? No, your voice is not clear. I think you have to go to a different place. By that time, I will go to the next person. Please adjust your location and then I'll call you back. So next we have Chetana Prashant, but Chetana Prashant is in the office, so she will not be able to ask questions, but she is participating in the telecon. That's very nice, Chetana. Thank you so much for taking out your time. Next, I see Priyanka Hemant, sorry. Priyanka Hemant, are you there? Idirama Priyanka Hemant? Okay. Hello, Priyanka. Thank you so much for participating in this telecon. Can you please, ನೀವು ನಿಮ್ಮ ಬಗ್ಗೆ introduce ಮಾಡ್ಕೊಂಡು, what we are trying to talk is 21st this month we are actually looking at the Maternal Health Awareness Day. So,
Okay.
ಈ maternal health awareness ಬಗ್ಗೆ ನಾವು ಇವಾಗ ಮಾತಾಡ್ತಾ ಇದ್ದೀವಿ. So, what I'm trying to discuss is, ಇವಾಗ ಎಲ್ಲರೂ ಪ್ರೆಗ್ನೆನ್ಸಿ ಮಾನಿಟರಿಂಗ್ಗೆ ಅಂತ ಬರ್ತಾರೆ, ಬಟ್ ಪ್ರೀ ಕನ್ಸೆಪ್ಷನಲಿ ಬಿಫೋರ್ ಪ್ರೆಗ್ನೆನ್ಸಿ ಅಂಡ್ ಆಫ್ಟರ್ ಪ್ರೆಗ್ನೆನ್ಸಿನೂ ನಿಮ್ ಹೆಲ್ತ್ ನ ನೋಡ್ಕೋಬೇಕು. ಸೊ ಈ ವಿಷಯದ ಬಗ್ಗೆ ನಿಮ್ಗೆ ಏನ್ ಅನ್ಸುತ್ತೆ?
Actually,
ಇಂಟ್ರೊಡ್ಯೂಸ್
plan-
ಮಾಡ್ಕೊಡಿ ನಿಮ್ಗೆ. Can you introduce
Plan-
yourself? Yeah, you're
Yeah.
talking about planning pregnancy, very important. So can you please discuss about that?
planned pregnancy is the best pregnancy ನನ್ನ ಪ್ರಕಾರ. So that
ಪ್ರಿಯಾಂಕಾ, ನೀವು ಎಲ್ಲಿಂದ ಬರ್ತಾ ಇದ್ದೀರಾ? ನಿಮ್ ಬಗ್ಗೆ ಒಂದ್ ಸ್ವಲ್ಪ ಇಂಟ್ರೊಡ್ಯೂಸ್ ಮಾಡ್ಕೊಳ್ಳಿ ಒಂದ್ ಲೈನ್. ದಿಸ್ ಇಸ್ ಗೋ ಇನ್ ಟು ಅ ಲಾಟ್ ಆಫ್ ಪೀಪಲ್. ಸೊ ಎಷ್ಟೋ ಜನ ನಿಮ್ನ ಕೇಳಿಸ್ಕೊಳ್ತಾರೆ. ಸೊ ನಿಮ್ ಬಗ್ಗೆ ಒಂದ್ ಸ್ವಲ್ಪ ಇಂಟ್ರೊಡ್ಯೂಸ್ ಮಾಡ್ಕೊಳ್ಳಿ.
ನನ್ನ ಹೆಸರು ಪ್ರಿಯಾಂಕಾ, ಮಲ್ಲೇಶ್ವರಂ ಇಂದ ಬರ್ತಾ ಇದ್ದೀನಿ.
ಓಕೆ, ಏನ್ ಕೆಲಸ ಮಾಡ್ತೀರಾ ಪ್ರಿಯಾಂಕಾ?
ನಾನು ಹೌಸ್ ವೈಫ್.
ಓಕೆ, ಫೈನ್. ಸೊ ಪ್ರಿಯಾಂಕಾ, ನೀವ್ ಹೇಳಿ, ಇವಾಗ ನಿಮ್ಗೆ ಕನ್ಸೀವ್ ಆಗಕ್ಕಿಂತ ಮುಂಚೆ ಡಾಕ್ಟರ್ನ ನೋಡೋದ್ರಿಂದ ಪ್ರಯೋಜನ ಇದೆಯಾ? ಇದ್ರ ಬಗ್ಗೆ ಡು ಯು ವಾಂಟ್ ಟು ಟಾಕ್ ಸಮಥಿಂಗ್?
ಇದೆ ತುಂಬಾ ಪ್ರಯೋಜನ ಇದೆ. ನಮ್ಗೆ ಗೊತ್ತಿಲ್ದಿರೋ ಪ್ರಾಬ್ಲಮ್ಸ್ ಎಷ್ಟೊಂದು ಎಲ್ಲ ಟೆಸ್ಟ್, ಬ್ಲಡ್ ಟೆಸ್ಟ್, ಸ್ಕ್ಯಾನಿಂಗ್ ಎಲ್ಲ ಮಾಡಾದ್ಮೇಲೆ ಗೊತ್ತಾಗತ್ತೆ. ಸೊ ನಂದು ಕೂಡ ಇವಾಗ ಆಟೋ ಇಮ್ಯೂನ್ಸ್ ಪ್ರಾಬ್ಲಮ್ ಇತ್ತು ಅಂತ ನೀವು ಐಡೆಂಟಿಫೈ ಮಾಡಿ ಹೇಳಿದ್ರಿ. ಸೊ ಅದೆಲ್ಲಾನು ನನ್ಗೆ ತುಂಬಾ ಹೆಲ್ಪ್ ಆಗ್ತಾ ಇದೆ.
ಓಕೆ, ಸೊ ನೀವೇನ್ ಹೇಳ್ತೀರಾ ಅಂತಂದ್ರೆ, ಇವಾಗ ಬರೀ ಪ್ರೆಗ್ನೆಂಟ್ ಆದಾಗ ಅಥವಾ ಪ್ರೆಗ್ನೆನ್ಸಿ ಆಗದೆ ಇದ್ದಾಗ ಮಾತ್ರ ನೀವು ಡಾಕ್ಟರ್ ಹತ್ರ ಹೋಗ್ಬಾರ್ದು. ಮದ್ವೆ ಆದ್ಮೇಲೆ ಪ್ರೆಗ್ನೆನ್ಸಿ ಪ್ಲಾನ್ ಮಾಡುವಾಗ್ಲೇನೆ ಡಾಕ್ಟರ್ ಹತ್ರ ಹೋದ್ರೆ ಸ್ವಲ್ಪ ವಿಷಯಗಳೆಲ್ಲ ನಾವು ಟೆಸ್ಟ್ ಮಾಡಿ, ಥೈರಾಯ್ಡ್ ಪ್ರಾಬ್ಲಮ್ ಇರ್ಬೋದು, ಶುಗರ್ ಪ್ರಾಬ್ಲಮ್ ಇರ್ಬೋದು, ಅಥವಾ ಫೋಲಿಕ್ ಆಸಿಡ್ ಟ್ಯಾಬ್ಲೆಟ್ ಕೊಡುವಂತಹ ವಿಷಯ ಇರ್ಬೋದು, ಇದೆಲ್ಲ ನಾವು ಸ್ಟೆಬಿಲೈಸ್ ಮಾಡಿದ್ರೆ ನಿಮ್ ಪ್ರೆಗ್ನೆನ್ಸಿ ಸ್ವಲ್ಪ ಐ ಮೀನ್ ಐ ವುಡ್ ಸೇ ತುಂಬಾ ಸೇಫ್ ಆಗಿ ಆಗೋ ಚಾನ್ಸಸ್ ಇರುತ್ತೆ. ಕರೆಕ್ಟಾ?
ಹೌದು.
Very important point. Thank you so much, Priyanka. You brought a very relevant point today. So next I see Kezia. So Kezia is also my favorite acquaintance. Thank you so much for joining, Kezia, on this wonderful day when we are talking about maternal health. So Kezia is a proud mother of 2 wonderful kids. And I take the pride for having delivered Kezia. Now, Kezia, can you please come on these things? Can you show yourself and start talking about why it is important to concentrate on maternal health both before, during, and after pregnancy?
First thing, good morning, ma'am.
Good morning. Happy Sankranti and happy Pongal
Sankranti, ma'am.
from all of us.
Thank you, ma'am.
Yes.
And happy Sankranti and happy Pongal, everyone. And ma'am, yes, planned pregnancy, I mean, is very much required. And I had 3 miscarriages before. So I understand. I mean, if you take a hasty step and then if you are not careful in planning before, if you lose something later, if you lose something later, I know how much it pains. I've gone through that. So it's important to have planned pregnancy. And yes, you will avoid many losses in that case, in that way. And that way, I mean, whatever has happened in my journey, I've understood it helped me notice whatever is wrong. I mean, whatever is going wrong inside my body, and take appropriate measures accordingly. So that way, I mean, I came to know that I was autoimmune, and later I was diabetic. So which were like very key points that would affect the baby's health inside me. So that's when all these issues were addressed properly. So I had healthy children, and yeah, thank God, and thanks to you, ma'am, for continuously going through it. And you have meticulously planned my, entire pregnancy journey. And I had my children. I mean, you were even expecting them much before that, but still, one of them came out at 34 weeks, other one at 32 weeks. So it's a good thing. And even post pregnancy also, I believe maternal care is important because on and off I've been neglecting my health, and I can see that. And if a mother is not well, the whole family will be affected.
Absolutely. Absolutely,
Mother,
Kezia. Well said. And
mother
Kezia,
is
don't you feel that, just like how you build a house, so you go and speak to your architect and a civil engineer and say, I want to build a beautiful house. I want to plan my room like this, my kitchen like this. So, don't you think pregnancy is so important? And every woman should speak to her doctor, not only when she is in trouble, but also even otherwise. Because some small things, like for instance, you had lost three babies before you actually met me, and it was such an emotional trauma, but you were strong enough to come out of it. But I see so many women who get so disgusted and they start cursing themselves. My life is all over. I just have to live with these abortions. So can this kind of a situation be prevented? Do you recommend that every woman should meet a doctor in the preconceptional period and take her or his advice, so that the first pregnancy itself is safer?
absolutely, ma'am. That's very much needed. I mean, as I said, better early than later. I mean, if the kid, if the, I mean, if the expecting mother is at loss, I mean, if she loses the baby at the end, what is the use? And even if the mother, expecting mothers are complaining, means they should renew their mindset. It is, I mean, they
No, no,
can't.
what I'm trying to say is, instead of coming after problems set in,
Yes,
now I
yes,
think people like you are strong motivators who can inspire others to say that you can make your pregnancy safe in the first attempt itself, isn't it?
absolutely. That's what, ma'am.
You should not leave pregnancy for chance. It has to be by choice, isn't it?
Shouldn't take it for granted, ma'am. This is a child, and this is a this is a future of, I mean, myself as a parent, and future of the family. And I'm raising a generation that will lead this family further. So I should be very careful regarding a baby that I'm going to have. So people should be very careful about, uh, I mean, about the pregnancy much before. Even
Absolutely. So if we can meet these women before, in case they've had problems, it's better to reach out. Like what Kezia said, after the problems had occurred, she came to us before she was pregnant. So we had some kind of time to set right certain risk factors. And the moment she conceived, we already knew about what problems could complicate her pregnancy, and we could make it very safe. Isn't it, Kezia? And
yes,
now with that, she actually got pregnant again, and both her children are doing well. Their names are Smile and Shine, which I, fondly call them. I call them Smile and Shine because they actually brought light and happiness to all of us. So that is one. And second thing, Kezia, I wanted to ask you, post delivery, now that you are a delivered mother, I think your children are 8 to 10 years old. Now, don't you feel that you should take care of your health? Maybe, see, you know about the cervical cancer vaccine. So this is something that now we are actually vaccinating every delivered lady. We were not doing it at your time. And this is something that can actually protect you 98% of times from HPV related cancer. So do you think every woman should vaccinate herself? Nowadays, the young children are getting vaccinated, between 9 and 15 years, so that the protection is there at the time of, from the time of adolescence. So don't you think every woman should come and take the cervical cancer vaccine?
yes, ma'am. I haven't taken, but I got my son vaccinated couple
Yeah,
weeks
even
back.
sons can. So you
Yes,
also should come, Kezia, and it's
yes,
a very
ma'am.
important step because during pregnancy, you have a propensity to have a lot of infections. And when
Yes,
you have these vaginal infections, what happens is the mouth of the cervix can get affected with HPV. This is a virus, human papilloma virus, and this can actually lead to cervical cancer, and this is preventable. So I think I urge all the mothers here, including you, to please meet us and get the
sure, ma'am.
cervical vaccine done. And please get your pap deo. That means your pap smear with HPV screening once in 5 years. during your reproductive age group. Actually, they say even up to 60 years of age to actually prevent this cervical cancer, because we can be alerted. Thank you so much, Kezia, on this very special day that you came and shared your wonderful experience. And I'm sure a lot of people will be inspired by your strength.
Thank you,
Lakshmi
ma'am.
Preeti, are you ready?
Yes, ma'am. Yeah,
I can
ma'am.
hear
Can
you
you
very
able
well.
to hear me now?
Yes, I can hear you, and I can hear and I can see you. You're looking very beautiful.
Oh, thank you, ma'am.
Okay.
Hi,
And
one
Lakshmi
second.
Preeti is my another favorite acquaintance, and I know her entire family. And in fact, all of these, all of these people are very special people in my life, and along with their children. So, Lakshmi Preeti, can you please? She's a brave lady. Can you talk about your
Ye-
experience? You had a problem in the first pregnancy, but you did not give it up.
Yes.
You came and met me and then went through the preconceptional drill, the preconceptional evaluation drill, and it took some time, but you delivered a healthy baby. So, do you want to talk about this to others and inspire other women who have lost their first pregnancy and, they don't know what to do?
Of course, ma'am. It's a glad thing that we met you when I had a first miscarriage.
Where are you
You are
from,
the
Lakshmi
first person
Preeti?
who told me
Introduce
you have
yourself.
another chance.
Lakshmi, can you
Hi,
introduce
this is
yourself
Lakshmi
briefly?
Preeti. This is Lakshmi Preeti. I'm from Bangalore. I'm from Uttarali. I've been in touch with ma'am since 6 years. So I know her since actually my aunt who delivered a twins because of her after 14 years of their marriage life. So after that, we met doctor because I had a miscarriage at the month of fifth month, and ma'am was the first person who told me, "You have another chance. You don't ever get disappointed, and don't think this is the end. I am there for you." So that gave me a confidence, and I said, "Okay." And she did a lot of several tests just to recheck whether the baby in the womb is fine or no, because she was the first doctor who never neglected and took it for granted. She just checked each and everything, and we were so happy to do all the tests whichever ma'am had asked to do. And that gave us so much confidence that okay, there is some issue in the baby, so let us not take and risk the baby also. And she made an attempt, okay, take 6 months gap, come back to me. And she had a lot of pregnancy, what all tests has to be done, what to be taken care. I was overweight. She asked me to reduce around 8 to 9 kgs. So I went through all that. Many, and she gave a doctor suggestions also. We went there and took lot of second opinion and came back. And then ma'am took me and gave me each and every step how you have to be, what all you're supposed to do, and what is very important. She was the first person, I think, more than a god. I've seen ma'am in that place. Today I'm happy. I'm so happy and celebrating every festival with my daughter. She's 1 year, 2 months now. She's Shasha.
Wow, beautiful. Hi, Sasha. How are you?
She walks now and she'll talk. It is all
Fantastic.
because of ma'am, which she has gifted us, and we cannot forget. And even at the time of pregnancy, I didn't know what are the major things to be or minor things to be taken care. Ma'am was so concerned and giving me every updates. The team of Mirrors was so supportive and giving me everything. Okay, if anything is there, ma'am used to call me even I am in need anytime. Ma'am used to never reject my call or never took lot of time to reply my messages because I was all alone in the house. I was not knowing how to be done if anything emergency or anything. So ma'am was very supportive, and she was one of the best teacher of my life. And
Thank you so
later
much,
on at the
Lakshmi.
time of my pregnancy, like in ninth month, I didn't know that my baby, she was like, she was not having a proper kicking or whatever she does, the natural activities, that was not regular. So then I had a checkup. I went there, ma'am did lot of checkup, scan, and in that way, Govind Rajan sir. In every scan from the beginning, I used to only ask, how is the baby? everything is fine. He always used to smile and say, don't worry, everything is fine. Everything is fine. That used to give us so much happiness because I never seen anybody could explain the scanning thing. See, your baby is here. See how she's sucking her thing, how she's doing, how she is kicking. You don't worry, everything is fine. Just listen what doctor says. So those things we cannot forget. And after the day I had that issue, ma'am said we have to do the immediate delivery within 1.5 hours. You don't know how much she has taken that time. She was so much thing that okay, in 1.5 hour, your baby should be delivered. She's not able to breathe or not able to have a proper space in the womb. So immediately she did all the documentations, everything, and she delivered the baby. And she, as the first person to hold her and show me, this is your daughter. So after that, we had other kind of. We have a very good relationship, more than a doctor and a patient, like a family person. She treats us so well. Whole my family members respect Revathi madam and Rajan sir so much. Even today, they say because of madam, we have 3 kids in the house. Were really very family made us so happy because of doctors. And I actually made madam said you don't have any issues. You have minor fibroid to be taken. So we did that process. Immediately after 6th week, she asked us to plan. Immediately I conceive now normally, like in a normal way. So that is really a best gift. And after the pregnancy, after the delivery, ma'am asked me to go with the cervical cancer uh,
Vaccine.
yeah, so that one. And I took all the 3 doses, and really that I never knew that. And I never knew that has come. It is so helpful for the female because we don't know our after certain age or in future what all comes to our internal bodies. We are not aware. The madam took so much initiative and updated, and I really took all that whatever the doses. And after that also, she was so concerned. We were, me and my husband, Pratap, we were so happy. She said, come, I'll do one regular checkup. We went and we did a regular checkup. Then she said, okay, all fine. Just need to work on your weight and sugar, whatever you are eating should be less. So don't worry, we'll plan for another baby also. That sort of a confidence, that sort of a positiveness we get every time we meet madam. And that smile, whatever she gives, that builds confidence to anybody. And I've referred many people whom I know who are really suffering without having a baby. I know how much they'll be going through. And I hope, ma'am, they'll be coming to you
Yes. Thank you,
for
Lakshmi
the
Preeti. Yes.
treatment.
Yes, there have been a lot of, after you, there have been people who came and met me for the preconceptual evaluation. You have really done your job by telling them what is the importance to look, to identify factors which can complicate pregnancy and conception. In fact, it was a very stormy pregnancy, her first one. The baby had several anomalies and she was not able to place as to how these defects actually happened. And then we had to analyze each of these factors before she conceived. So things went on really well during her pregnancy. And post delivery, also, Lakshmi Preeti is a typical example who came to me and checked, made sure that her health is all right. And she understood how frequently she has to monitor her sugars and her thyroid abnormalities, etc. And also concentrated on her weight and took the cervical cancer vaccine. So I urge, or if Lakshmi Preeti can do it, everyone else can do it. So I think we still have Indira who has joined us, and we need to speak to Indira. I think we will take that extra 10 minutes. I request all of you to please rejoin back once this link expires so that Indra will also contribute her story and her, she can ask her concerns